it's important to educate yourself. I think that's the theme of this conversation today is education. And I think it's important for people to educate themselves, not just about the procedure, but about the provider and how they feel.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Matthew Onassis of Onassis Skin, who is a distinguished nurse practitioner trained in the art and science of aesthetic medicine. With a robust academic foundation from the prestigious University of California, Los Angeles, and graduating summa cum laude from West Coast University, Matthew brings a wealth of knowledge and a deep understanding of the sciences to his practice. He also holds a master's degree in nursing from West Coast University, emphasizing his dedication to the field. Matthew utilizes cutting-edge technology and techniques to treat complicated skin conditions such as acne scars, pigmentation, and even has advanced training in liposculpture, a procedure that has been gaining popular attention in recent years. So Matthew, welcome and glad to have you on the show.
Thank you so much for having me.
Yeah, so let's dive right into it. How did you first get interested in aesthetics?
So originally I wanted to go into plastic surgery, and I actually attended med school for about a year. I dropped out after realizing how long I was going to be in school, and the endeavor itself is definitely a dedication. And I had previously worked for a plastic surgeon as well, and I really thought about it and realized it wasn't for me. There wasn't a lot of, if the patient has this condition, this is why we treat them. In the field of medicine, there's a lot of protocols. And I think that in the physician world, it's very difficult to steer from that. And I really enjoyed patient care as a nurse. So I think that was my calling. And I was an assistant for a doctor who was on a popular show, Botched, actually Paul Nassif, and I worked with him. And I realized being closer to the patient rather than in and out of a room was something that I really appreciated. And I know nurses get to do that more so than physicians. So I enjoyed the aesthetic industry ever since I was little. So yeah, it's an art, and I wanted to be in this field for that reason.
Got it. Now, can you talk about some of the most popular treatments that your patients come to you for? And also, why do you think that they're so popular? I mentioned before in introduction, liposculpture. So would you include that in the list, or are there other ones as well?
So it's hard to narrow a single most popular treatment, but I will say that people will come for various reasons, whether it's a pimple or a little redness. Like I had somebody come in today, their kid had scratched them and left them with a little red mark. But I think more vulnerable patients are what gives me the gratifying opportunity to serve them, and that's for acne scars. That's a huge one. And I think it's because a lot of people don't have access to proper health care, or maybe from cultural reasons, socioeconomic level, they don't have access to proper health care to treat acne at a young age. As a result, they're left with scarring. That's my huge focus. I really, really dedicated myself to wanting to help patients with acne scars. With liposculpture, a lot of patients have stubborn fats, and they don't want to they've tried working out, for example, their stubborn fat. Those are more recent popular procedures. I don't perform those in my office, but I work with other physicians that do. So we're incorporating that into our practice as well. There's a lot of rejuvenation procedures, but it's really across the board. Anywhere, like I said, from little redness or rosacea or scratch, all the way to permanent scarring like acne scars, and we treat everything in between.
Got it. Now, are there any new or emerging treatments that you're particularly excited about?
Yes, there are. With lasers and devices, it's not so much that the technology in itself or the treatment is new. I think the innovations and advancements into cutting technology is really in the delivery of the laser treatment. So I'll give you a perfect example. I have a Cyton device with a really popular treatment called BBL, broadband light. One of my more popular procedures. Previous to this, it was IPL, intense pulse light, that people would have to rely on for something like laser hair removal or treating a spot or redness in the face. And BBL is a more advanced delivery system of that intense pulse light.
Mhm.
And it's a patented technology called BBL, broadband light, and it delivers it much more efficiently, less painful. And it's just a more advanced way with more parameters that you can really adjust. So there's a lot of different wavelengths that are messed around with by scientists, PhDs, and providers like myself. We like to incorporate newer technologies to see how those applications will work. There's different wavelengths that we haven't used before, but all in all, technology doesn't really change too much, but like I said, it's the delivery and protocols. And that's what we're advancing in skin health.
Got it. Now, with these new treatments, these new protocols, you mentioned it's more about the person who's actually doing it than the technology itself. So
Right.
how would you tie that in? And I want to kind of understand a little bit more about what differentiates your practice from everyone else in your area, all your competitors. So I'm sure the skill level is one of them, but could you talk a little bit more about really what differentiates your practice?
Right. I think when you look at dermatology, there's a lot. When you go to medical school, or let's say a dermatologist is gone through schooling, they really learn about protocols. Like I was saying in the beginning, if a patient has acne, you prescribe tretinoin. If a patient has pigment, you prescribe hydroquinone.
Mhm.
And those simple protocols will yield some result, but we're living in an age where people don't want irritation, they don't want to peel, they don't want to, use a product for 6 months before they see results.
Mhm.
And the biggest thing is cost.
Mhm.
So unfortunately, insurance companies will kind of decipher what gets approved as a protocol,
Mhm.
not just the provider. However, since I am fortunate enough to work with patients paying out of pocket,
Mhm.
I'm able to use things that insurance companies haven't even approved yet under their protocols. And they will work with collaborative physicians in incorporating the most basic protocols to get the patient from point A to point B to get their results. But they're not going to get results quicker. They're not going to get the best results. So, to answer your question, what differentiates me from a lot of providers is that I like to study the market, to study the science. What's being published now isn't really going to roll out as a protocol
Mhm.
for at least 5 to 10 years.
Mhm.
So, going out and learning from conferences, from courses abroad and locally really helps me deliver the most advanced and latest published evidence-based practice to patients.
Got it. Now, you were mentioning before that some of the patients that are maybe have to rely on insurance, and the insurance companies are so far behind that they're not getting the best care. What kind of advice would you give to those people that kind of have to rely more on insurance, but they're still looking for something that can help them? I mean, maybe it takes them a bit longer, but what would be your best advice to them?
So my best advice would be to do research on ingredients of
Mhm.
skincare. So if they do that, they can actually buy things over the counter a lot of times,
Mhm.
or medical grade products. And that term is used very broadly.
Mhm.
Medical grade just basically means it's a brand that's trusted, sold in a medical office. You don't need to see a provider a lot of times for some of the products like azelaic acid, some retinols. I have a few brands like IS Clinical. I have my own line with some potent vitamin C serum that can help brighten skin.
Mhm.
So it's really a combination, but I think first and foremost, investing in your skin is a thing that you have to consider. Some patients don't need certain treatments, but I think if you get a consult with someone that's willing to teach you and educate you about the different ingredients and skincare, it really doesn't cost a whole lot more than going to somebody who takes insurance. And if you educate yourself, I think you can get the right skincare. You can treat yourself without the crazy laser treatments that some people do out of vanity, or they really want to aim at certain defects.
Got it. Now, I'm sure that you get some patients that come in and they're looking for one thing, but it's really not the best fit for them. So, what are some common misconceptions that you see from your patients about the treatments that you provide?
Right. That's a great question. I will say, I always tell patients, if you come in with a laundry list of 20 things, I'm probably going to say no
Mhm.
to 17 or 18 of them.
Mhm.
So I like to tell patients, when they point out a problem, it's not only when you're doing a certain expression. If there is a problem, it's something that should be there, whether you're expressing or not. And not everybody needs filler. People are always running for injectables. I think injectables are misconceived as making people look puffy and just not a healthy thing to put in the body. But I think that's wrong. I think if it's properly placed by a responsible provider and a responsible patient, because sometimes the patients can find someone who's willing to say yes. But I think filler is one of them. It's a misconception that everybody needs filler. Not everybody needs filler. And I think with the advanced products that we have out, we have Sculptra, we have different dilutions of Sculptra, we have Radiesse. Those are two collagen modulators, which unlike filler will slowly produce collagen and volume over time, rather than this abrupt volumization with hyaluronic acid. Yeah, it really depends. I think that every patient can have a different misconception, whether it's about a laser that's they're a good candidate for, or an injectable, or Botox. Some people want Botox every 2 months. They don't want any movement in their face. Yeah. And that's another misconception. So it really depends on the patient.
Got it. Now, you mentioned before with filler and people thinking they're going to get that puffy look to it. Kind of came up with this question that's related to that is, I'm seeing more and more providers talk about their patients wanting to get a more natural look, like kind of long gone are the days where they want to be like, it's the overblown with the Botox and the filler. Is that kind of something that you're also seeing with your patients? People asking for more of that more natural look. They don't necessarily want people to know that they're getting something done.
It's very interesting being in LA. I think being an LA native too, it really puts a trend out there. And I like to preach this to patients too, is that less is more. And I like people to age and age gracefully. And if we're changing something or fine tuning, it really doesn't need to be a lot. And I think it does need to look natural. And I'm very fortunate that my patients usually come to me. It's usually their first time getting filler, or they've done a little bit in the past. And I have come across patients that are like, I want that blown up look. Fortunately, I'm able to convince them to dissolve, start over. And some patients have dissolved and said, you know what, I'm really happy I did that. You held my hand through the process, and I'm really not ready to add any volume now. So yeah, it's being natural is so important, and looking natural, and just fine tuning is what I like to call it.
Got it. Now, when it comes to that natural look, that fine tuning, I'm sure that you get some people that are looking for something maybe a little bit different, or even like the Instagram filter. Do you get any of those people that come in, the Instagram filter's like, I want to look like this?
I don't have that reputation of, and I think some providers will get a lot of those people if they see before and afters where the person looks like a completely different person.
Yeah.
They'll be like, well, you know what? This provider makes people look completely different. I'm going to show them a picture. I think that I put myself out there as like, look, these are the enhancements that I've done. I try to be descriptive, in social media posts, but I actually don't get people showing me photos. I don't look at photos. I look at them. The only photos I will look at is if someone wants to show me what they used to look like. And even then, there's only so far back we can look at, because we're not doing surgery. We're just doing fine tuning, like I said. And that's with injectables. With overall skin health, I think people want to look forward, not look back, because they obviously want to have a better skin quality and better skin health. And that's not something they're going to show in a photo. But when it comes to changing someone's face, I don't look at, an inspiration, so to speak.
Got it. Now, you brought up as far as like when people come in, when they show these photos, if it's a huge difference, in that case, maybe they need a facelift. So kind of in your own words, how would you describe the difference between the treatments that a medical spa provides and the treatments that your traditional cosmetic surgeon gives to the patients?
Right. So that goes with expectations. So if someone is expecting surgical results, I tell them to seek out a surgical consultation. And we partner with doctors in every specialty. So we are definitely equipped to give them several names in each specialty, whether it's a vaginoplasty or a tummy tuck or a facelift, a rhinoplasty, you really have to go to someone who does that specific work. And some people aren't ready for surgery, but they want those results. And that's when I turn them down sitting in the chair. It's like, okay, well, you know what? This is what you will get with a non-surgical route. And for a surgical intervention, you're going to get a better result or more drastic result. And it's funny that you bring up facelifts because that's actually a huge thing with younger patients that are saying that they're ready for a facelift. And I think a lot of times we look at the media and we see certain celebrities who have drastically changed over the last 10 years. We've watched them on TV and they're like, well, they got a facelift and I think I'm ready for one too. And so it's actually very interesting and it's emerging. And I don't think it's a very bad thing if someone goes to the right person and they have the skin laxity. But again, that's on the provider or the surgeon in that case. But with surgery, I don't tell people they're going to get a surgical result. It's just reality.
Got it. Now, you talked about this a little bit, but would you mind diving a little bit deeper into how you approach educating your patients about the services, the treatments you provide, and also the benefits that go along with them?
Yeah. So when I get a patient that comes to me, let's say they're talking about getting their lips done, a very popular part of the anatomy that they get treated. I will discuss if they're a candidate, first of all. Second of all, if they are, what products I use. And I use a wide array of products for the lips. There's so many different filler technologies and they all have their own benefits and their own candidates that they're good for. So then I'll go through, and for some products, they can actually feel a gel to see what that product actually feels like in a little tray. And I kind of give them an idea of the longevity of the product and results. And I always tell them clinical studies may show that it lasts longer. The box says 2 years, it may last 5, it may last 4, I don't know, or less. So I really like to educate the patients really about the technologies, whether it's a laser, an injectable, or even a neurotoxin. So with neurotoxins, we have newer ones on the market. Xeomin in the last, 15 years it's been out, the last 10 years. We recently got Daxxify on the market, which is a longer lasting neurotoxin we found out with double the units used. So I like to educate patients about whatever treatment they're getting, whether it's a chemical peel, a laser, a neurotoxin filler. I like to tell them about the differences and how it works. That way they're able to educate their friends too. And they also come to me and that's the first thing they say. You educated me, you took your time, and I really appreciated it. So that's kind of how I educate them.
Got it. Now, when it comes to actually providing the actual treatment, can you talk about how you balance providing that relaxing experience for them so that they're not stressed out, they're very relaxed, but also at the same time, ensuring their safety and well-being? So
that's the first thing is safety. I tell people this industry is 95% safety and 5% creativity. Some may argue the balance may be a little different, but in my eyes, I think the most important thing, and that's what's running through my mind, is safety. And I do explain the procedures to patients. I explain the risks and benefits. And I really tell them I take the safest approach that I can. Given the anatomy, we're taking consideration safety. And I try to provide a relaxing experience. And I think that patients, when they're fully understood of what's happening and what they're getting done and why that's the tool or why that's the laser we're using today, they kind of feel like they're in good hands because they've been explained about the process. So I think they're just actually really excited, more so than nervous. I don't have many patients that are nervous. The only ones that I think get squeamish or nervous or hard to cradle patients are ones that are just scared of needles in general. But that's pretty much it.
Okay, got it. Now, we talked a little bit before about insurance and like the reason that they're so far behind is because they need to come up with this protocol and they have to approve the protocol. So and I think that's what a lot of people think about when it comes to any type of medical treatment, that there's a plan in place, a step-by-step process. With that in mind, what role do you believe creativity plays in the way that you approach your patient care?
So with insurance, to answer the former part of that question, I'm doing my doctorate right now, and my focus is in dermatology and acne scars particularly. And part of it is advocating for the passage of certain laws and regulations and approvals for certain protocols. And that's a long process on its own. To answer your question about utilizing creativity on patients, two-part answer actually. For patients who maybe have an affordability issue, I try to work with them in giving them a slower but effective process that we can do that's more effective than just the simple skincare that might be provided. That might include, an easy laser treatment like Clear and Brilliant, Additionally, with creativity for other patients that maybe have more severe situations like acne scars, there's an abundant number of treatments that we can do. And there are some treatments like subcision. We can do certain injectables to kind of lift those scars, but there's a lot of things that we can do. It's not all on the super high end price, but people spend their money in different ways. I think some people go out to eat, some people go to amusement parks. Some amusement parks are so expensive nowadays. They're more than a laser treatment for a full day of fun. So I think everybody has their vice, but like I said, with skin health, it is an investment. And I do like to work with people on whatever side of the spectrum they're on and their expenditures. And yeah, we can get creative.
Okay. And you said there was another part to the creativity aside from the affordability part?
Oh, sorry. Yes. So the other part is layering treatments. So we utilize a number of modalities on patients that actually create more effectiveness in the results. And I think that it was frowned upon, as little as 5 years ago. And now they're trying to incorporate and encourage these protocols in non-insurance practices to increase the results. So basically, before, people would go in, expect one laser treatment to be in and out. Now people are doing as much as 4 different modalities in a single treatment session. And I think the creativity part of that and the science is we're normally taught to go, deep to superficial. And some people have come out and said, well, no, you can actually switch these 2 steps over and do this first instead of last, and you'll get even better results. So you kind of have to fine tune your own protocols and to see what works. And you have to take into consideration the patient's skin type. But yeah, there's a lot of room for creativity. And I didn't know that there was this much really until I'm in it. And no one really knows, but it's really fun. And I have to say, I really enjoy it. And I think my patients kind of see that I enjoy it. And they're like, I'll be your guinea pig for anything. Even with liposculpture, with the creativity part of that, I think patients know that I'm safe, that I like to be creative and I like to have, a design to whatever I do. And I was just posting recently about how I attended a training for liposculpture. And I've had a flood of messages. Some patients were like, I'll be your first patient. I'll do this, I'll do that. And I'm just like, wow, people really trust the process and they trust me. So I think if you're safe, people will run to you for you to use that 5% of creativity, whether it's with lasers, liposuction, injectables. So I really don't take it for granted. That's why I think the biggest thing is safety. But that 5% is still a lot.
Got it. Okay. Now, throughout your experience, I'm sure you've run into some particularly challenging cases that you've had to work on. So is there one story that you can think of that it was just a really tough case, but in the end, you were able to get them a successful outcome?
Yes, there have been a lot of instances. One instance was an acne scar patient. And these kind of patients really propel me, I think, in my work. But he had come to me, he had done a lot of different microneedling sessions elsewhere. And what's interesting is that it wasn't a cost issue. And he was very adamant about treating his scars. And I said, look, this is what I have right now. Technology wise, we can do all this and we can see where it goes. He drove a very far distance. I think it was like a 3-hour drive each way.
Wow.
And so he'd come for a weekend, get the treatment, look crazy, and then go back home, the next day. And I had just got in my new device. It was my Cyton, actually. And so I called him up and I said, hey, I want you to come in for this treatment. We had done several series and he came in, we blasted him. We did Morpheus 8, we did Halo, and also traditional microneedling. And I also incorporated topical exosomes. And so that was a huge undertaking because, how I mentioned before, considering the patient's skin type was something that I did. However, it was a lot of heat, and I did tell him that you might pigment. And when patients pigment, they'll most of the time in his case is go darker, where there's too much heat. And that can be reversed with skincare or peels. And I said, look, I'll commit to depigmenting you if that happens. And he agreed. So it was a huge undertaking, but at the end, after he healed, he was very, very happy with his results, and his scars are nearly gone.
Wow.
Now he's working on, Botox and fine lines and here and there instead of focusing on acne scars. He's really excited about his results. So.
Wow. That's great. That's great. And I think that's one thing that people don't think about when it comes to the aesthetic industry. I think the common perception is that, oh, it's just about vanity, it's just about looks. But they don't really think about the people that are really kind of suffering from some condition, or it's just because of the way they look, it's really been holding them back emotionally, or it's just traumatic for them. And after they get something like this done, it completely turns their lives around, changes their lives. I think a lot of people miss out on that part of what really goes on with aesthetic practices.
Yeah. And, I have been so fortunate to be working with patients after being trained in many different capacities. People charge so much for these treatments, and for a lot of people, they can't afford them. They just can't. It takes a long time to get to a point where you're comfortable to use all these modalities in a single session. And I really feel that's a soft spot for me, is those patients. And, like you said, they're not here for vanity. They're here to feel comfortable in their own skin. And that's not to minimize anyone's feelings, because some patients do feel insecure about, certain wrinkles, or, their chin is too small, or they want bigger cheeks. But yes, I think from a medical perspective, those patients do have a different reason. And it's not vanity, like you said.
Yeah. Now, Matthew, where do you think the future of aesthetics is going?
I think the aesthetics is going in a very interesting direction. I think that injectables are going to drop in price. I think that people are going to steer away from injectables. I think that we're moving more towards technology-based treatments. I think that the price of those services for injectables on the consumer end may go up. But on the provider end, though, they may go down. And I think we're seeing a lot more products come from the east to the west. And, for example, in Korea, they've been doing mesotherapy injectables with, hyaluronic acid and these hydrators. And we just got our first one approved just recently with the Allergan or AbbVie line, Volite. And that's a newer product, but it's been around for decades. In Korea. So, and those products are becoming less and less expensive. We're getting more brands in, there's different injectables that are coming out, but it's all about the art, and I think it's going to be more difficult for some providers who are not trained or don't know or educated about all the different products, because it's like a paintbrush. There's so many paintbrushes coming in, and nobody knows. A new provider wouldn't know that this paintbrush is better for this canvas and this one is better for this. And I think it's going to weed out a lot of providers too, because at least in this market, people are always trying to educate themselves. So they know about the different paint, they know about the different canvases, and they know about the different brushes. So they'll quiz you. Patients will quiz me sometimes. They'll be like, did you hear about this new product? And I'll say, yes, I don't carry it yet because I don't know about this ingredient or this or blah, blah, blah. So I think it's going in a very interesting direction, but I'm excited for what is to come, because whatever it is, it's going to enhance our results.
Got it. Now, Matthew, I have one last question for you, but before I ask it, I want to point people to your website at www.onassisskinhealth.com. Now, the last question is, what do you think is the most important piece of advice you can give to someone who's kind of on the border about getting some type of aesthetic procedure done, but isn't sure which provider to choose?
I would tell them to research the provider and read the good and bad and invest in a consultation, but don't necessarily get the procedure right away if you don't feel comfortable. It's important to educate yourself. I think that's the theme of this conversation today, is education. And I think it's important for people to educate themselves, not just about the procedure, but about the provider and how they feel. And I think go with your gut. It's important to trust them, because it's not going to be a one-time thing. You're going to build a relationship with the provider in their office. And it's important to feel comfortable and heard and followed up with. So that's what I would say.
Got it. Well, there you have it. Matthew sharing his expertise. Now, Matthew, where can people contact you and your practice?
So they can email at info@onassisskinhealth.com. And they can also text or call us. If they just go on our website, or even Google. They can see the phone number there, and they can text or call. It's 424-333-1212.
Okay, great. Well, Matthew, thank you for being on the show and sharing your message.
Thank you so much for having me, Daniel. Have a great rest of your day.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.